University. It is my pleasure to introduce this evening's moderator, Dr. Salim Razak. Dr. Razak is a director of the Office of Social Accountability and Community Engagement and a professor of pediatrics and health sciences education at McGill University. He practices as a pediatric critical care medicine physician. His major interests in medical education include assessment, equity issues, and social accountability in health professions education. Dr. Razak, the floor is yours for the remaining of this evening. Thank you.
Thank you, Dr. Banerjee. As the director of the SACE office, I would like to say that it's been a lovely series of collaborations with the School of Global and Public Health. And this is yet another. And I think that this is a very timely and important topic for us to discuss today. And we have 3 panelists lined up. I will introduce them in a second. I thought I would just go through a bit the ground rules. So the first ground rule is that we will have lots of time for questions. We have a couple of things that we're going to ask the panelists to comment on. But then after that, we really hope to engage you with all of your tough questions and maybe some of your tough comments as well in the discussion. And I would ask that if you are to do that, that you use the raise hand function. So that way we know where you are in the queue and so on. This session is being recorded, and please let us know if that is an issue for you. Our plan is really to put it up on the SACE on the website for it to be available. And I'm just making sure that I am correct with that. Iman, tell me what our plans are with this recording.
Yes, that's correct. We will put it on our YouTube channel and we will then link it to the SACE website.
That's correct. Okay, so our 3 panelists today are Professor Madhukar Pai, who for many of us needs no introduction. Can you just raise your hand so that we can, there's Dr. Pai, who is a Canada Research Chair in Epidemiology and Global Health at McGill University and Associate Director of the McGill International TB Center. And many of you will know that Dr. Pai has also been quite active in the engagement of media of all types around vaccine equity during this pandemic that we have lived. Welcome, Dr. Pai. Next is Dr. Marina Salvadori. Please raise your hand just so that everybody sees you. So Dr. Salvadori and I are actually colleagues at the Montreal Children's Hospital. So my usual interaction with Dr. Salvadori is around a critically ill infant in whom I am generally begging to have some restricted antibiotic be prescribed. No, that's or to receive expert infectious disease advice. But Dr. Salvadori is actually a very accomplished vaccine specialist and vaccine advocate. She is a professor in the Division of Pediatric Infectious Diseases at McGill University and very interested in vaccine preventable diseases, immunization, education, and awareness, and has advocated locally, provincially, and nationally for publicly funded immunizations for children. At the end of January 2020, she joined the Public Health Agency of Canada as the clinical lead for COVID-19. And since then, she has lived, breathed, and dreamt all things pandemic. So welcome, Dr. Salvadori, and so good to see you in this kind of different context. Finally, we have Joyez Senga. Joyez, can you raise your hand? There you are. So Joyez Senga is a Master of Science in Public Health student at McGill University and has a bachelor's degree in health sciences and Public Health from Stanford University. She previously worked as a research associate to the Vice Chancellor at the University of Global Health Equity in Rwanda, and has been involved in multiple public health projects in the United States and Canada. She's passionate about advocating and promoting all-encompassing public and global health research that transcends controlled environments to better understand the most effective ways of delivering quality and equitable healthcare to vulnerable populations. And she spearheads community initiatives to increase literacy among children and youth in Rwanda by encouraging the proliferation of African-authored stories and those written in the local language Kinyarwanda. And she's co-authored papers concerning mental health in children and adolescents, physical activity in pregnant women, and community-based research. So we just met this time in the actual planning of this event, and I'm very much looking forward to what you have to say. Reading about your work related to kind of the social determinants of health, of reading stories in your own language as a child really resonates with me, because I actually think that losing culture is sort of one of the determinants of health that we don't always talk about in medicine, and certainly in pediatrics, and it really resonates with me. That's a side conversation to today's conversation of vaccine equity, but maybe not. So I'm gonna ask if Iman can help put, or maybe put it on speaker view so that when people are speaking, we'll see them showing up. But I'm gonna start by asking each of the three panelists this one question, which I would ask them to respond to. I have basically three questions for the panelists, and then after that, we will open it up. So I'm going to start with Dr. Pai, and I'm going to ask you what the case is for vaccine equity. And I'm going to start by recognizing that in this audience, there might be those of you who want to roll your eyes at being asked, like, what's the case for vaccine equity? Certainly we had some discussions when we were planning this. But I think we need to hear the reasoned arguments in order to respond well when asked. And this is the same question that I'm going to ask to all three panelists, and I'll start with Dr. Pai.
Thank you, Salim, and thanks everyone for joining us. So I have written a blog post, which I'll post a link soon, or maybe Ananya can, where I have provided 10 arguments for vaccine equity. I won't list all of them here, but I think the simplest way of looking at it is it's the morally and ethically the right thing to do. As rich nations, we cannot just give ourselves third, fourth, fifth boosters and hope like this pandemic will end, because it will not end. Everybody deserves access to life-saving medicines, especially during a crisis. And saving lives is the right thing to do. But beyond that, if we were to look at it from a very selfish perspective, which is what I suggested when I was asked to speak to the parliament last week, I was given 5 minutes to say exactly this in the House of Commons. And I told our MPs, so even if we don't want to do the right thing, just do this for the most selfish reason, that is reducing viral transmission globally is the only way to prevent worse and worse variants from emerging. And the subvariants are very transmissible and wreaking havoc in many parts of the world. So if we want to prevent a next bad variant, we've got to vaccinate the world equitably. And then there is the strong economic reason. To me, this is one of such a stunning economic calculus. Nobel Prize winner, economist Joseph Stiglitz, wrote a paper in PLOS Global Public Health. I invited him to write as an editor, and he published it just 2 weeks ago. We'll post a link in the chat box as well, where he basically says, as a Nobel Prize winning economist, that this is the no-brainer as far as he's concerned. He's saying we put down billions and we vaccinate the world, and we save trillions in the lost economies, in the extreme poverty increasing, the inflation, supply chain disruption, in every possible way, allowing this pandemic to continue is doing no good to anyone, including us. So even from a pure economic standpoint, helping get this pandemic under control is our best and fastest pathway out of this mess.
Thank you so much. I'm going to move on to Dr. Salvadori, and I'm going to ask you to speak in your voice, well, in whatever voice you want to speak as a physician, as a public health person. What is the case?
As you said, it's a bit hard to see beyond. It's just the right and moral thing to do, and I think that's what drives most physicians, most people who work in public health. And in fact, I really believe that most humans care about other humans, and we want people to be well, and we would like everyone to not live in poverty and not suffer. But if we take that aside, I think that from an infectious diseases point of view, I'm just going to put a little bit of thoughts around Madhu's argument, that some of which I don't quite agree with. Before Omicron, when we thought we could interrupt transmission and we weren't sure how this entire pandemic was going to unfold, there were a lot of evolutionary virologists, et cetera, who said we're going to have to vaccinate everyone to prevent mutations. And since Omicron, there's a counter argument that any evolutionary pressure causes escapes. So this is an immunity or an immune escape variant, which whether people get naturally infected and have natural infection, or they get vaccinated, that perhaps might drive some immune escape variants. So I don't think that that's not necessarily the right argument. We actually do not know. This is a brand new pathogen that we have really not been around to see how something like this, how it evolves, how it changes, and what to expect in the next 2, 5, 10 years. We just don't know. But I think what we have learned is that viruses and health inequity, it finds the health inequities, and people who are disadvantaged by so many different ways suffer disproportionately, and any kind of disharmony and lack of all working together and being on the same page, we have to row together, because if we don't, if people feel disenfranchised, left out, some people get sick and other people don't, I think that it really weakens our global goal of all of us advancing together. So for me, it's just the right thing to do. We've all, agreed to millennial goals of development. And even within our own country, we should be very careful, because the inequity was visible in our own wealthy country. So, and we've then seen it in the globe on a far larger scale. So to me, this is the opportunity, as we continue with the human project, for us to improve and for us to get it right. And we all care about people everywhere in the world.
Thank you. I like I think that's a new word. The vaccine finds the inequity. I think that's that's got me thinking. So I'm going to move on to Joyez, who will speak from your perspective in public health, as a student in public health, but also as someone who has lived in Africa as well. So Joyez, to you.
Yeah, thank you so much. I think first as a public health student, I would say data, which is very obvious, but that's something that we have to consider. But beyond that, it's really about recognizing the value of human life. Because when we look at global vaccine equity, it's those that are vulnerable. It's those that have been oppressed throughout history that are facing these consequences. So we really need to look at that and say, what are we doing? What are we changing? And for me, as a young person, it's calling out the leaders to rewrite the history, because we've seen this with with what happened with HIV. I think I was probably like 8 at the time, but it's really shameful to see that we know what happened, but we're not even learning from the history to take a different path. So for me, it's really just a call to the leaders to say, what am I doing as a leader today to write a different history, to value the human life of those who cannot access vaccines today?
Thank you. Thank you. And just moving now on to our next question, which is really like, you know, you've laid the case, you laid the Dr. Pai laid the selfish case. All of you talked about kind of the human rights, it's the right thing to do case. So then I guess my question is, why hasn't you know, action followed intent or stated intent, right? Like, what are the barriers that we see? And perhaps I will start with Joyez, and I'll go in reverse order.
Yeah, I think there's so many reasons, but one that quickly comes to mind, again, relating to what I was just saying, is first, the effects of colonialism and racism that we're still facing today. To be honest, a lot of people do not care about someone sitting somewhere in a village in Africa, whether they're vaccinated or not. They just don't care. And so again, it's coming back to the understanding that that life doesn't matter as much because they don't maybe contribute to their economic gain or political agenda or policy agenda. And so really looking back at this life matters and this should be done differently. It's also the lack of partnerships between many Western countries and many local communities, because you cannot really understand the need if you have not built those partnerships and those relationships to look at the individual stories. So we really need to break those barriers in where we need to, people usually say, give people in low-income countries a seat at the table. And for me, I say, we need to destroy that table, you know, build a new table that brings people together to really brainstorm the ideas of what is needed and what needs to work for everyone, not one person assuming what has to work for the other.
Okay, may I just follow up, because I think you're sort of hinting about the possibility of trust the other way being a kind of a problem as well. And I'm wondering if you could just elaborate a little on that before we move on to Dr. Salvadori.
Yes. I guess even just speaking from my personal experience, I was back home in Rwanda when vaccines started rolling out. And many people in the community were like, why should I trust a vaccine that was developed in the West? Do they want to kill me? They're like, there's so many attempts that have been, you know, done on poor people, on Black people, on so many Africans. And so they're like, why should I really trust this person? Do they have my best interest in mind? And I think that speaks volume really to even as public health practitioners, if the people that we're supposed to serve do not even trust that we have their best interest at heart. So as you said, I was hinting to it, but it really just begins with trust. But you cannot trust the person you have not built a friendship with or a relationship with. So it starts with going into the community, going and listening to those people and actually sitting with them and having a conversation.
And building a new table with them, perhaps. Yeah, thank you. Dr. Salvadori, same question.
Yeah, so this is a really hard question to answer for me in a concise and short amount of time, but I'll try. I am going to start with that. I believe that the intent was genuine and real, and I do believe that. And I'm quite certain that part of what we're doing is judging something that would happen very quickly with a little bit of hindsight. And there was a lot of things that could not have been figured out ahead of time. This was such a rapid fire, thing. We didn't know mRNA vaccines were going to work. No one had ever used them before. Even at the very beginning, Bill Gates put money out and said, I'm making 5 manufacturing facilities in the United States for the 5 different types of vaccine because we think one might work. So there's all of those complexities as well. And so you can imagine, we had to keep these in -80 freezers. Like all of that complexity was incredibly difficult to navigate in time, supply chains, etc. But I would just like to talk about, if the intent is genuine, and I believe it is, and this was such a fast and rapid and upside down cart, the whole entire pandemic, what can we learn from it and make sure that should this happen again, that we will arrive at equity on time, in real time? And I think we have to learn from the history of vaccinology. So I'm just going to put a few really important things on the table. So the first one is, you can't talk about vaccines without talking about Jonas Salk. And he invented the polio vaccine, and it's very famous words when asked, who owns this vaccine? And he looked and said, a patent? Who has a patent on the sun? Who owns the sun? So I think that whole ethos around vaccines is very important. Then if you think about the other really big names, Morris Hilleman. Morris Hilleman actually started as a scientist at Merck, and he ended his whole career as a vice president of Merck. And he invented 40 vaccines in his lifetime, including 8 of the 14 that we give to children nowadays. And he was always in industry. And you have to understand where he comes from, and industry has to be a partner. We cannot paint them as the villains. Industry, actually, there's a large history about why there's so few vaccine manufacturers, why we didn't have any in Canada. And it has a lot to do with, it's, for the most part, making vaccines was high risk, very low profit. But the scientists, et cetera, who work on those have made really amazing contributions. And I believe they're also coming from a good place. And then thirdly, we have government and structures. And if you look at some things that have been international, what I would call hit out of the park, is Gavi, the Global Alliance for Vaccine Initiatives. Now, it took some time to get going, but we have really improved the vaccination rates and of children around the world. COVAX was loosely founded on that, but we didn't have time. Like, we have to figure out, this is a truly complex problem. So we need governments, we need industry, we need NGOs, and most importantly, as Joyez points out, we need all the people involved from all the different areas, and we have to figure out some sort of a new construct. So for me, I think that we need to come up with something that'll say, if this ever happens again, for example, just healthcare workers, no matter where they live in the world, are the most important people to keep things going. And they need to come first, so that we prioritize on a global scale. So there's lots of different thoughts and solutions, but I think that we have to realize that we're all partners. And as Joyez says, we need to make a new table, but that table has to have a seat for everyone around it. And we have to believe that they're coming with good intent.
Thank you. Thank you. And I'll move on to Dr. Pai.
I think it's worth quoting Paul Farmer here, where he, his powerful quote from one of his books, "The idea that some lives matter less is the root of all that is wrong with the world." And I think this is pretty much what happens in global health again and again and again. We have dual standards in global health. When HIV/AIDS came on the scene, all of you know, antiretroviral were pretty much available only to the rich nations. And it took like a decade before it started appearing in sub-Saharan Africa, by which time we lost millions of people, right? Now, are we willing to wait for 10 years for the African continent to get the COVID vaccine rates up? Or are we willing to act on it fast? So to me, this duality in how global health works is that for us, those of us who are privileged, who are in the global north, we are happy with the third doses, fourth doses. We want everything. We want Paxlovid, we want rapid tests, we want PCR, we want the whole package. But then when it comes to low and middle income countries, we're willing to set a very low bar for them. We're now willing to say it's okay if they don't have access to vaccines. Certainly they don't have access to antivirals right now. Not even us have access, let alone sub-Saharan Africa. So this is a recurring theme in global health, in every aspect of global health. In the work that I do in TB, look at TB, I'm still using BCG. which is a 100-year-old vaccine, which sucks. Right? And the investment in TB vaccines for a century is COVID vaccine investment is 1,000-fold higher than what we've invested in TB vaccine in 100 years. That's because we just don't care about diseases that primarily affect Black and brown people in the global South, or indigenous for that matter, right? TB rates in the indigenous population in Canada is 300 times higher than the rest of Canada. So this is a recurrent theme in global health, nothing new. Paul Farmer has written books about this. We know what the problem is and why the world is so broken in the way it is. The question is, what do we do about it? And this is why when I spoke to the House of Commons, I chose to focus on why self-sufficiency of global South countries is the path forward, not only in this pandemic, but in the next pandemic as well. Nobody should rely on rich countries for this trickle-down charity model that is broken. They need to be self-sufficient. They need to have access to what they need to do. And that is how they're going to end this pandemic for themselves, because they've given up on us, right? The global South countries by now have seen what rich nations are capable of. What they don't want is charity. What they want is justice. They're saying, give us a recipe. We're going to make the vaccines. And even if they don't give the recipe, we're going to reverse engineer it, as South Africa is doing it, as many countries around the world are doing it. This, to me, is the surest path to a more safer tomorrow, not this reliance on donations and charity from rich countries, which may or may not give.
Thank you. Thank you. I think, so for the last question, I'm gonna sort of hijack Joyez's table metaphor again, right? So I think all three of you have said that the table has to be chopped down and rebuilt. So that's really a metaphor for the structures that we live under. And I'm going to ask you, in order to move forward, what is this table going to look like? How do we move forward for greater global vaccine equity? And I'm going to give the last word to Joyez, and I'm going to start with Dr. Salvadori this time. Dr. Salvadori, Dr. Pai, and then Joyez, and then we'll open it up.
Yeah, so I mean, again, I wouldn't say that I know enough to say exactly how we should set this up. I think it would take a very large amount of discussion amongst all the players, because this is really like, it's international. It would be like setting up, you know, WHO plus NGOs plus people from all the countries plus manufacturers. We have to work through all of these organizations. We have to, you know, work through what exists to understand and reduce the patent issue. And so to me, I wouldn't say that I have a quick, fast answer, because it's an extraordinarily complex problem. If I had a quick answer, everybody else would have it too. But what's very clear is that we need to listen to every voice that was involved in this whole endeavor from beginning to end, and learn from the myriad of lessons, as people have said, from HIV, from others, and make sure that after this global crisis, we get it right.
Thank you. Thank you. Dr. Pai.
Again, I would say that anything we can do to improve self-sufficiency of other countries, we should support them. And whether that means TRIPS IP waiver, whether it means tech transfer, whether it means collaborations, partnerships, anything that works. And I just want to give Canada, us as an example. All of you remember in 2020, we had no ability to manufacture vaccines, and we did not have a Canadian vaccine. We were desperately looking for shipments from other countries, Pfizer, Moderna. And we know the pain of not having the ability to domestically make things of our own. Today, we have fixed many of that, right? We have a Canadian vaccine. Montreal will have Moderna manufacturing in Montreal. The government has invested millions of dollars in fixing this big blind spot that we had, so that we as Canadians are no longer dependent on other countries if the next crisis were to come along, or even for the next generation vaccines, we are self-sufficient. If we have that aspiration for ourselves, that we need to be self-sufficient, why would we not support other countries with their aspiration to be self-reliant? This is what is critical. I'll quote for you a wonderful statement by the head of Africa CDC, John Nkengasong. And John says, never ever should we have had to keep counting on externalities to take care of our own security needs. A key pathway for collective global security is an Africa that is self-sufficient. To me, all of us, the richest nations, at a minimum, should not be a barrier for low and middle income countries to be self-reliant and self-sufficient, because that is what makes the planet safer, when more and more people can make their own products, develop their own solutions, and take care of outbreaks before they become global pandemics.
Thank you. Just before moving on to Joyez, I wanted to ask you a follow-up about self-sufficiency. We had talked when we were planning that countries that have their own vaccine, like so Cuba, India, China, that have their own vaccine, vaccine potential are doing well. But one of the questions that I have for you is, and this isn't really quite self-sufficiency, but really South-South relationships versus North-South relationships, which I believe have less potential to be exploitative and so on. And I just wonder if you might just comment on that before we move on to Joyez.
Absolutely. So we know that any country that has been able to manufacture domestically has done better. Cuba, India, China, Russia are all examples. And that is why WHO is investing in mRNA hubs, right? So there's going to be a regional mRNA hub in Africa. South Africa is already the site for it. Similar efforts are happening in other countries. It may come too late for this pandemic, but it will certainly empower the continent to be better prepared for the next pandemic, or even for developing next generation vaccines that are more tailored to Omicron subvariants, so on and so forth. I'm also hoping that this will also trickle to not just vaccines, but also self-sufficiency in making tests and antivirals, right? I'm very worried about antiviral inequity as well. So there's a treatment inequity, there's a test inequity, there's a vaccine inequity. I think all of them need to be addressed. And that to me is the future.
Thank you. Joyez, last words before we open it up to everyone.
Yeah, I would say the first thing is, I get scared when people say we have to wait, like we cannot wait for the next pandemic. The first thing is to act now. People are dying. Many of us know personal stories of people are dying because they cannot access the vaccine. So I think in the public health, global health world, we need to, yes, let's think about the next pandemic, but also let's take urgency to act now. The next thing I want to say is, as a young person, even maybe some of the audience might be students like myself, we need to form the partnerships today, right now. We're not going to form the partnerships between the global south and the north in 10 years when we're stakeholders in different positions. If we don't form those partnerships now, I'm afraid we'll end up where we're calling out on leaders today. So we need to take the agency to build those trustable partnerships among ourselves. I'm pretty sure the people that I sit next to in class today will be leaders somewhere tomorrow. So those relationships have to start now. And I think thirdly, in higher education, we need to foster an environment that encourages research and innovation, especially for students that come from low-income countries. I think sometimes it's really sad that you ask a professor to explore a topic about your country and they're like, no, the assignment is clear. You need to write about Canada, or why should I write about Canada? I care more about my community and what I can do for them and what I can use the knowledge to do for them. So I think it's really important in higher education to stop thinking that all the solutions are in the West. I am the solution for my community. I'm ready to put in the work. You just need to give me the platform and the chance and the mentorship to do that. So I really want to encourage, especially young students, young researchers from Africa and from other low-income countries, we have the confidence that we can do this. I'm very hopeful. I have many friends that are brilliant and smart. And for me, that's what keeps me going every day. Yes, today with COVID-19, we're seeing all the trouble, but we can do it. We just need to feel more empowered, need to be supported. And at the end of the day, like what my colleagues have said, we are the ones to bring those institutions. We are the ones to build the sustainable healthcare systems that will help our countries.
Thank you. That was such an eloquent way to end the sort of formal part of the this session. It's really got me thinking. It's got me thinking about kind of sovereignty and self-determination as like social determinants as well, you know. So you've given me much to think about, Joyez. I'm going to open the floor, and I hope that there are some interesting and maybe stuff that gets us thinking that people might want to say. So just raise your hand if you're interested, if you have a comment or a question. And don't be shy.
Also turn on videos if possible. It would be nice to see some faces.
Yeah, nice to see people if you can turn on video. Go for it. I'll just give you a little, I see a real hand being raised. Like, I feel like I'm in a real life again. So that is Anita.
I have possibly a strange question, an odd question, and forgive me if I'm inarticulate and it's emotionally charged, but sometimes I'm in situations where I'm with people who don't even know that vaccine inequity exists, and they don't know the factors behind it. They are not even aware about patents. So sometimes, because I get emotionally charged, I can't come up with a succinct response, and I'm not that well versed. So I was wondering if somebody, or if all of you, give me a short, succinct response to people who just think that some countries are just not doing it because they don't feel like it. You know, it's a tough situation to be alone in a room. And I was wondering if there's resources you could point me to, or a response that I will just copy and paste and use in these tough situations. Thank you.
So I will, any or all of the panelists can weigh in on that. Any, maybe, and if nobody wants to weigh in, I will call upon you because I'm the chair. So I'm going to start with Dr. Pai.
There are so many articles written on this. So maybe a powerful one would be the piece by the Nobel laureate, Joseph Stiglitz. And I have pasted the article. It's a short article. It's in the chat box. And it's written in a very clear manner. I was very impressed with his speech, and I invited him to write for my journal, which he did. I think I would start there. If you want a short video, then I'll try and find you a good one to share as well.
Thank you very much.
I think the way you're talking, though, reminds me that there is a kind of a cost to the ignorance, you know, like a kind of an emotional cost to it. And not that we want to overjudge that, but what we want is we want a way to bring people, to help people come out of it together with us. Marina or Joyez, any comments?
I've just found, so my whole background is in, partly I've done a lot of work in vaccine hesitancy, etc. So I think that we have to stop polarizing these arguments. It is not like black and white. Actually, it is truly very complex. So in fact, in certain areas of the United States, a wealthy country, but rural Black people are less vaccinated than anywhere else. That's true. And so do you just say, oh, it wasn't made available to them? No, you don't. You look deeper and say, what are root causes? How did we all contribute to this? You know, these are really big problems that are now facing us directly. So there's not a simple, fast solution. And with people like this, you know, I think that you have to say there's many things that we don't know. And it's quite true that actually at this point in time, we have more than enough vaccines in the world. And there's actually a vaccine manufacturing plant in South Africa. India is actually the world's largest producer. And yet still they all have gluts of vaccine. They're not actually being taken up. So I don't think then the way I frame that is not, wow, like, you know, we're giving them and they're not being taken up. I have to ask the question, why? And I think that gets to the real root of the things that we're all discussing. Why is there a lack of trust, as Joyez has said, in some groups? What have we done? What are the colonial roots? What are the reasons that we have not done this whole vaccine rollout human project in a way that benefits everybody? And you can look no further than our own doors at seeing the inequities that were existent in Canada, all the way from who got sick, who got PPE, who gets different things. It's different along educational lines and privilege and all these other things. And these are the matters of our generation. We have to really dig deep. It's put a mirror right in front of us.
Joyez, any comments on that?
Yeah, I was just going to add that we also need to share success stories. I think it's also sad that in global health, no one is talking about Rwanda, for example. They've managed to vaccinate more than 60% of the population. But when we talk about global vaccine equity, we're always speaking to the negatives. If Rwanda did it, there are definitely strategies that were put in place. A system was built, you know, leaders worked together with the community, with community health workers, with the nurses, with the doctors to make this work. So I think especially the reason why some people always argue that, well, these countries don't want vaccine. It's that even as public health people, as global health people, we're not talking about the successes. We're always talking about the negatives, and we don't paint those stories. So I think it's really important to share the successes of things that have been done as well, to highlight that it's doable and it can be done.
Thank you. And I saw Dr. Larson's hand up before. Did you want to say something, Charles?
Yeah, I don't want to throw cold water on the autonomy of local countries, in particular low and middle income countries' capacity to respond to the pandemic and to have that capacity to produce whatever is necessary to deal with this pandemic, vaccines, medicines, and whatever. But I find it a very fragmented approach to thinking about this. And I come to, and I think a lot about, the power that we heard earlier today about anti-science, disinformation. And I worry a lot about us, I guess, thinking of this as country by country by country in terms of how we're going to deal with it, and the lack of any really meaningful, strong, global, international, if you like, I don't want to say control, but it may, authority or mandate to push this forward in a more global sense. We looked for years at WHO to do this. My sense of it is that we're finding that WHO is, for many reasons, not able to create this sort of international response that I think we need. And I'd like to hear people's thoughts on this. Can WHO respond eventually? Do we need another body? What do you think is necessary in terms of the global response to this pandemic? And what's missing?
So to the panelists, perhaps I'll ask Marina or.
Sure. I mean, again, it's such complex and deep, but I actually been incredibly impressed with how well WHO has done. Now think about it. Somewhere after this pandemic started, the US took away all their funding, just like that on a dime. So we would be dishonest if we weren't saying that WHO is also a bit of a political organization. They have to be careful of their stakeholder and funders interests. And personally, I think, but I hear what you're saying, you know, it's a nascent organization really. And how much have we all bought in that they would say we would follow their lead? If WHO told us to do something, would we follow them? I'm not so sure. But I think we can make things much like climate is trying to do. I think we can have summits with we have to get buy-in from all nations. And I think some of the things that we need to do is set certain lists of things that we all buy into. So first of all, I'll just give you some things that I've heard from others that I think are good ideas. So our government funding, CIHR, NSERC, all of these things, that should come with strings attached. That, so, you know, a huge amount of money went to Moderna from the United States. So we should have, if you got government funding, you thus should have X, Y, Z. If there is a global crisis, and we helped you develop the drugs, the price has to be at cost. And I think if we all signed on to international agreements, kind of like we do for nuclear arms, all these other things, and maybe that seems very pie in the sky. I think that's sort of a way around this, other than all of this bilateral, you know, coordination. And we need to have some discussion, you know, about what if something is declared a crisis, like HIV drugs is a great example. Those should be available at cost or less, but at cost to anyone who needs them. And we should have a list of essential drugs and essential that patents are either removed for indefinite amounts of times, but built into that, you have to put in the not the compensation, but the protection for the people who build those. If someone had made this vaccine and just said, hey, you can all use it, and then there had been catastrophic outcomes, can you imagine how bad it would have been? So we have to somehow get global alliances. We all sign on of principles of things that we can all do together, and that we will all agree to do through time for many health issues. But I actually just have to say, I've been pretty impressed by the WHO. And I think that with the right support and us not being so judgmental and holding our money back if we don't agree, or threatening them, like just happened with, you know, Mr. Trump, I think that we could use that group to do a lot of good as a globe.
Thank you. Comments from our other two panelists?
Yeah, I would say when I think about global health leadership, immediately I'm scared because we would go back to the power dynamic where many of the Western countries will take the lead, and we're building the image that the solutions are gonna come from the West. And I mean, the global leadership could come from, you know, other low-income countries. So let's say, for example, the Africa CDC took a big role with response to the pandemic. They called all the health ministers, all the presidents had a meeting when the pandemic started. And really that kind of regional response was really urgent and helpful because they know what their countries need. They know what the different countries lack and how they can help. So while I think, yes, the global health leadership might be important, but to me, again, it brings the whole power dynamics that we can get into. But I think we also need to value the role of the regional leadership, which I think the Africa CDC with Dr. John Kengasong that Madhukar quoted earlier, they did a great job bringing African countries together to respond to the COVID-19 pandemic.
Okay, Madhu, any comment?
I think Charles's concern that the world as a whole is not having clear direction on leadership is quite on the point. And I think this is also impacting our ability to deal with the climate crisis because we are not united as a world. And it really is a scary situation because politicians inherently are unable to look beyond national boundaries or provincial boundaries. They certainly cannot think beyond the next elections. So everybody is incentivized to do what is short term and what is immediately impactful or beneficial to get elected. Nobody has a long range vision. And that's why things like climate crisis are hard because what's coming 25 years from now, no politician is willing to bet their careers on making decisions around it. So it's really worrisome. And I think I would argue that more young people in leadership positions might bring the kind of long-term vision and collaboration that I think the earlier generations are somehow not able to bring. But I will also preface this by saying one worrisome trend about the rising tidal wave of right-wing nationalism, populism, and authoritarianism that's exploding around the world, right? Everywhere. That is scary in and of itself, because that kind of thinking is inherently anti-science, as we learned from Peter Hotez this morning. So no autocrat wants to support science. For them, anti-science is the best way to stay in power, right? And so if that's the way the world is headed towards, and anti-science is dangerous for the pandemic, it's also dangerous for climate change. You will notice a beautiful correlation between anti-vaxxers and those who do not believe in climate change. It's the exact same people, right? It's the exact same groups. And how to deal with this as how do we prevent the erosion of democracies that's happening in many parts of the world? That is something that's very scary. But both pandemics as well as climate crisis require a whole new way of thinking, which I think current global structures, as Charles said, is inherently not aligned with. That is why we are not able to work together as nations. We can only look after this nationalism and extreme forms of nationalism, that too, right? With very disastrous consequences for truly transnational events like pandemics and climate change.
Just a editorial comment from the chair. I think the tension between a kind of a controlled and hierarchical response and the local context is an interesting one to ponder, because I think it all boils down to who's at the table and how we're at the table in the controlled response. You don't, and I think we're all realizing that the globe is the globe, and we're kind of in this petri dish together. But that is something that's limiting us from kind of being together. I don't know if there are any final comments. If not, I will do two things. The first thing I'll do is to recognize that my mentor is in my ID mentor, Dr. Dorothy Moore, from whom I learned so much over the years, is in the audience. So welcome, Dorothy. So nice to at least see your name there. And to say that I miss you at the Children's. And I'll pass the for some final thoughts and some synthesis thoughts to Ananya, and then we will close. So Ananya.
Hi, everyone. I just wanted to thank Dr. Razak for moderating such a thought-provoking panel, and a heartfelt gratitude to all the panelists, really showcasing that the conversation behind global vaccine equity isn't always easy, and that having these different perspectives, yet coming together in solidarity is critical to really push the agenda for global vaccine equity, not 10 years from now, but at this moment. Hearing everyone's conversation, the conversations that have been taking place in the last hour, I'd love to share some of my reflections, and I've been very fortunate to work alongside closely with Dr. Pai in advocating for global vaccine equity in the last year or so. Vaccines were developed across the world in record time. That's something that we cannot deny. However, the widening gaps in global vaccine equity has really led to this two-track pandemic with booster COVID-19 vaccinations proliferating high-income countries such as ours in Canada, and yet first doses have yet to reach many populations in low-income countries. And as Joyez had stated articulately, we are not sharing those success stories that are much needed to really help low middle income countries to be able to come to that equitable state in achieving and having access to the vaccines. The reality is, and I use the term help, which I am actually being very mindful of not using, is that global vaccine equity demands reparative justice. It is not charity. And that is something that we need to really understand. We have seen a vaccine apartheid that is very rooted in colonialism. And what we are seeing during the COVID-19 pandemic is, again, no different from previous epidemics and pandemics that we have seen in history. This reprehensible imbalance is no accident that we are seeing in this pandemic, and that we need to understand that high-income countries, yes, their intentions are good in many ways, but they have used their neo-colonial negotiating power, global policy leverage, and capital to procure enough doses to cover 245% of their citizens, while leaving few doses for poor countries. And as a result, low-income countries may not be able to vaccinate their populations until 2023. I remember we were saying last year that low-income countries will not be able to vaccinate until 2022. And I imagine 6 months from now, we will be saying low-income countries will not be able to vaccinate fully until 2024. So where is the end in sight? That is a question we need to keep asking as the years keep getting pushed back. 2 years into the pandemic, I think we can confidently say that we have failed to achieve a global vaccine equity, but it's not too late. And there's still time to push for global vaccine equity to help avert suffering and deaths in LMICs, and also here in high-income countries, as we are not fully protected at all from future variants. Global vaccine equity is important to protect economies and prevent new virus variants. Well, it feels all of us here in Canada and among other high-income countries, we are rushing to declare the pandemic to be over, and having these stockpiles of vaccines to boost our way out of this pandemic is not the solution when there are 2.8 billion people who remain completely unvaccinated. So I'm hoping these events and all of us together recommit to decolonizing, decentralizing, and dismantling the vaccine ecosystem and further invest in equitable and effective country-led vaccination campaigns to overcome what we are seeing right now is the anti-vaccine, anti-science movement. Thank you, everyone, for helping me articulate these words. This is what I have learned from all of you. And I thank our audience today for joining us. And I really hope that we continue to have these conversations. Please stay safe, everyone. And once again, thank you to our moderator and all the panelists for this evening.
Thank you from the SACE office, from myself, and to all the panelists. And I will just say that the best thing I heard tonight was build a new table. And I think that that's going to be a rallying cry. And thank you, Joyez, for that metaphor. Good night, everyone.